Greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to try to talk this morning just a little bit about deciduous teeth. We've had several cases here where we show how we use them, and there's no reason that I know of that you shouldn't really use deciduous teeth in early treatment of orthodontics, especially. I don't think we've shown one here, but we do have some videos of children or people that have been mouth breathers from youth on up, and they didn't develop their maxilla properly, and their lower jaw spreads out more because they're holding the tongue in the bottom of the mouth all the time. Now, these are real important uses of deciduous teeth. So when you see that happening, you go ahead and put your palatal separator in on the upper and crank it apart and get it back to normal or even past normal to get the lower teeth inside in, and that's an important use of deciduous teeth. You use the 6-year molars and the two first and second molar of the deciduous teeth, and if they come out and the tooth is completely restored before you finish up, just go ahead and you can take it out or just leave it in there. You don't leave it too long, it slows down the development of the first bicuspid. All right, let's get back on this particular case. It's a simple case, and I'm going to go through it pretty quick, but it has one or two little tricks in it that I wanted to bring out. Now, this child just has this adenoid looking face with breathing problem, and he's a good kid, and he got a good vertical height of the face. There's no problem, so he's not breathing so bad that he's developed a long lower third of the face. This is pretty good down here, so I don't mind going in there and working with this. Now here again, when we've started him and we started working on his upper front teeth here, he had a couple of laterals that were locked behind, and that held the jaw in this position, so we wanted to get that out real early. This is something you just normally do real quick when you see it in here. Get the teeth lined up, get everything out of cross bites if you possibly can, break all the deciduous or the habits that people have, that thumb sucking and breathing through the mouth, of course, and any other thing they have. So we try to straighten that up and let it go. So here we do that. He's in a nearly class 1 relationship, so there's no problem there, and the lateral here is fixed in, so that's got the jaw kind of trapped in that area right there. Now we same thing on the other side, almost identical, and when you look at it up above, the laterals are back like that, and the deciduous cuspid is out on one side and throws this over to one side. There's less space over here than it is in this area right there. All right, we can cope with that, no problem. And the bottom arch is shorter space. The cuspids are short. They're coming in. So, and the child, we want to try and keep these teeth. Now, in here, you'll see this cuspid up here is right over the root of the lateral, and this one is coming into the lateral right there, even though we got some space. So we're going to try to maybe move this lateral root in that direction and help this cuspid come down here and behind the lateral. It doesn't show up real plain, but we show it in the second x-ray here, and it looks like it's even worse at this point, and the one over here is getting worse. So we've elected to go ahead and start some interceptive and preventive orthodontics, and that's the way it should be. This is 1985, and so we've got a bunch of deciduous teeth down here, and we use those teeth in helping us straighten this up. We just keep the wire from having such a long distance between the permanent molar and where you'd been up here. Go ahead and band those teeth, or rather bracket them, and then we'll use them throughout the treatment. And this Panarex isn't too good, but we've got some spring in here, and we push this root over this way, and now you see the cuspid is behind the tooth. So we have pushed these teeth together and tried to get the roots over here, and that is about all it needed. Let me go back and show you see where that cuspid was right there. Now we put this little spring in there, and we can put some tip on those roots and kind of bring them together, and gives a little more room for the cuspid. Now watch the room come in here. You see the cuspid coming down there, and now we'll go to another Panarex down the line. The cuspid's got room to come in now, and we'll come on down in space into place. And here it is, another view, and this is coming in good right now. Now this young man had a mild class 3 kind of situation, and as he gets older, his lower jaw moves forward a little more, and this is one thing you have to watch about trying to correct class 2s or bad class 2s. If the parents on either side, or even their grandparents, they have a class 3 problem, and you've got a class 2 case, don't try to correct that thing all the way, because they may grow out, especially men, will grow out as they get older, and this guy's done that same thing. So you have another little trick that you can pull off here, and you've got mild class 3s. You can take the wisdom teeth out on people early and leave the upper wisdom teeth alone, and they'll form some kind of pressure and push the upper arch forward a lot of times, and then you lose the pressure you got down here. This is causing a lot of the class 3 movement. People think the wisdom teeth doesn't have an effect on these. This is wrong. The wisdom teeth affects the whole thing. It'll put pressure on it and move these teeth forward. So let's look at the guy as he gets a little bit older. Now here it is in 1988. We still haven't removed those wisdom teeth, or sent him to get them out, and it's 1988. I'm going to go through the showing just what we did in here. We put these springs in and pushed these laterals together, and had some kind of a tip in there that brought the roots forward in here and gave room for the cuspids to end down in that area. So we use the deciduous teeth, and when they go, we just take them out, and then a lot of times we'll put just a step-up arch in the space if it's real big, and here we didn't need to. All right, this opening this space and making room for the cuspid to come down in this area right here, and you start that. And this is why preventive and interceptive stuff should be done as the child develops. Don't wait till they're 12 or 14 and send them in. The cuspid sticking out over the laterals up here, and it's a real problem then. Just go in early and kind of prepare things for them so the child never experiences real crooked teeth or anything like that. So I recommend that pediatric dentists know certain amounts of orthodontics and go ahead and do it, and don't be upset by if you disturb the orthodontist. Now, you really need to know that, and I think they ought to teach preventive and interceptive stuff in the orthodontic schools. So the orthodontist, if he goes and helps pediatric dentists, really knows a lot of things to do, and you do them earlier. So that's just my the way I have fussing about it. All right, here we go. And now the bicuspids are coming in, and we've opened up space, and we've got a gap here that we're going to want to put the cuspid in this space. And as soon as this tooth gets in it, we will bracket in and push back here on here. Now he's got a spring in there, got a lot of junk in it, and we'll try to get these teeth back in this area, see. And this is going to be a little bigger, so there'll be some space in here to put this the first bicuspid in there, and then your cuspid will have a little more room to come in. So this is using these deciduous teeth early on, and we've got this one bracketed, but it'll go along with the rest of it. All right, down on the bottom arch, we're doing the same. We have no braces on the bottom arch at all, but this has gotten loose, and if we needed to, we can come in and take some of this tooth off and let the bicuspids come in right in here, and this first bow being here, then this cuspid can move back in this area right there. When that happens in this, and you can see it in just a minute here. All right, there the upper teeth in. We've taken them out of the braces, and we're waiting to come in and do the second phase of the treatment after this develops, and we get nearly all the permanent teeth are in the mouth when we come in to do that. And this, now the cuspids are coming in, and they're still got crowded out, but they'll push their way down and push these backward in here. And so we're going to take the wisdom teeth out of the lower arch and leave them in the upper arch, so it'll push this forward in there. Now you look at the this cuspid, the second bicuspid is coming in under that tooth now, and we haven't done anything on the lower arch, so you can either slice it off here, or you can just take that tooth out, and the first bite will come on in, and the second bite will come in, and you've got some space from here to here for the two back. Actually, you've got some space for the first bite and the second bite to come in there. All right, we'll go back here, and here's the young man after he's matured and grown up, and when you can't see his teeth too good there, but his lower jaw has grown forward on him as he got older, and now we're just kind of an edge-to-edge situation, which, like we have shown you back here, we took the wisdom teeth out, or if they haven't been out, you take them out on the lower arch and leave them up on the upper arch, so it will push a little bit of this, and you'll get the teeth over the arch, and you'll have a little more overjet and overbite in the case. And that's a little trick of taking the lower wisdom, but leave the upper ones in there and let that press on that a little bit to move that forward. Hope you get something out of this and just some ideas about it, but we use these deciduous tea especially in preventive and interceptive orthodontics, and that's what we ought to do, I feel, really should. And so I'm going to say goodbye, and I hope you'll get something out of this, and we'd like for you to look at some of the other videos we have here. And thank you again, and join our group and subscribe to it. We'd love to have you, and I hope to see you again. And I'm going to try to close out here, if I can get this over. Thank you now.